Hi, good afternoon, Mr.
Hello.
Ibarra. My name is Alisa and I'm your nurse for today. We're going to be doing an assessment of your abdomen, okay?
Ma'am?
Before we begin, I just want to make sure that you've already gone to the bathroom to empty your bladder. Okay, perfect. We can go ahead and get started. So please lie down here and I'll put a pillow underneath your knees for comfort and to relax the muscles of the abdomen, and I will cover you up. I will move up your gown to expose the abdomen from the sternum to the groin area, okay? I will also place this lamp here to provide lighting to make sure that everything looks good. I will need you to relax, so try to breathe deeply and slowly through your mouth for me, okay?
Yes, ma'am.
All right, so I'm beginning by just inspection, observing the coloration of the abdomen of the skin. It is a little bit slightly paler than your arms because it doesn't receive so much sun. We're also looking at the skin vascularity, so you don't have any striae or any scarring here, okay? No vascularity, striae, lesions, or rashes. We're also noting the abdominal contour and symmetry, observing at eye level from the side. Can you raise your head for me, please? This way? Okay, good. And then I go around you to the back of the exam table. Can you raise your head for me again? Thank you. And then I go to the end of the exam table at the foot and ask for you to raise your head again for me, please. Normally, the abdomen should not bulge, which it doesn't in this case. You can relax. The abdomen is flat with good musculature, no masses and no bulges. We're observing also that the client is breathing, looking for any abdominal movement, aortic pulsations, or peristaltic waves, and there's nothing present, so that's good. Next, we are going to listen with our stethoscope. We warm up the diaphragm, and we use to auscultate the bowel sounds. We start at the right upper quadrant, left upper quadrant, then we move to the right lower quadrant, and the left lower quadrant. The right lower quadrant and the left lower quadrant. So we want to listen for at least 30 seconds. Vowel sounds normally occur every 5 to 15 seconds, roughly equivalent to one sound per breath. So, and if there's an area that we don't listen to anything, we want to listen for a full minute just to make sure that there's actually no sounds coming from there. Right now, your vowel sounds are pretty active, so I would say hyperactive for you. Have you had diarrhea a few days? That's probably why. So we'll go ahead and next, we're actually still going to continue with the stethoscope, listening with the bell, which is the smaller part. And this is to listen to auscultate for the vasculature sound. So we're listening for bruits over the abdominal aorta, the renal arteries, the iliac arteries, and the femoral arteries. No bruits are heard, and we continue with the bell listening for a venous hum in the epigastric and umbilical area. So we'll listen epigastric and umbilical. No bruits are heard, no venous hum is heard, and finally we switch back to the diaphragm and we listen for a friction rub over the liver, which is on the right upper. And then we also listen for the friction rub on the spleen. No friction rub is heard. So after auscultation, we can start with percussion on the 4 quadrants, following a clockwise sequence or an up and down sequence. Just depends on what's best. So we can go ahead and get started. That's the clockwise, and we can start from, that would be the up and down version. No tympani over all four quadrants, and donus over the liver and the spleen are heard. We next proceed with palpation, beginning with light palpation to assess any tenderness in any area and any guarding. Then we palpate a little bit deeper in all four quadrants, and we want to assess for any subtle masses and delineate the organs, the abdominal organs. And it might cause a little bit of tenderness with the palpation. Okay, abdomen is soft with diffuse tenderness on palpation, no guarding is noted, and no palpable masses are present. Next, we want to palpate deeply in the area of the umbilicus. We want to make sure there's no swelling, bulges, or masses. And we also palpate the aorta by palpating in the epigastric region, slightly left to midline. We cannot palpate it, but usually it's non-palpable. But if it is palpable, then you want to assess the aorta pulsation. And also in clients that are older than 50 years old, we want to make sure the width of the aorta. So width is approximately 2.5 centimeters, pulsation is strong and regular, and you have no tenderness. Next, we want to attempt to palpate the liver, which is usually non-palpable. So I'll ask you to take a deep breath in. Exhale. Okay, so first we palpate bimanually, and then we'll palpate by hooking. So this will be probably when you're laying down. And can you inhale, please? Take a deep breath. And exhale. Liver edge is smooth and there's no tenderness. Next, we want to palpate the spleen. Again, palpation may be performed the client supine or on your right side, laying down. So you can take a deep breath for me. Exhale. Okay, and we also want to palpate the kidneys. So we do the same thing for the kidneys. You will take a deep breath in, we palpate, you exhale slowly, and you hold it. And then you continue breathing regularly, and we do that to both sides. Spleen and kidneys are non-palpable and non-tender. Kidneys are difficult to palpate, so blunt percussion is used to assess for tenderness. And so we will get you sitting down. If you're laying down, we'll get you to a sitting position, and then we perform blunt percussion. So that would be by putting my hand and actually hitting the back of your back in the costovertebral angle. So we can go ahead and show that here. So I will put my hand here, blunt percussion, hand over fist, and we do on this side too. No costovertebral tenderness is noted. Thank you. So that's pretty much the assessing the abdomen. If you have any questions, do you have any questions for me?
No.
No? All right. Thank you so much.